Hi, I'm Michael White and I'm a doctor of physical therapy. Today we're going to be reviewing balance exercises that you can be performing on a pad. These exercises are designed to improve your balance and your stability. Today we'll be using this balance pad. This balance pad will provide an uneven surface to help engage your core, small muscles in your ankles, and then also your foot, but also the larger muscle groups in your legs, which are all designed to help improve your balance. An important note when performing these balance exercises, you want to make sure that your physical therapist has approved you to complete them independently at home. Typically, the balance exercises will be performed next to a counter, next to a chair that's very firm, or actually within two corners of a wall to prevent you from falling. You want to again make sure that your physical therapist has cleared you to do these exercises at home. So the first exercise we're going to go over is called the step up, and you're going to alternate legs. It's very simple. You just place the pad on the ground. It has a non-stick surface, so you can place it on tile, hardwood, without worry that it's going to slide. Again, you're going to want to do the exercise right next to a surface if you feel that you need support for your balance. So typically the patient will just step up and then step back down, and you want to alternate the leg. You can do 3 sets of 10 on each side for a normal routine. A progression to that exercise would involve stepping up and then over and then turning and repeating with the opposite limb. Again, doing this about 10 times or until you feel that you need to rest. The next exercise will be completed while standing on top of the pad. It should be known that you should be ready for that progression, so make sure again you clear that with your physical therapist. So while standing on the pad with your feet relatively shoulder width apart, all you are simply going to do is look to the left and look to the right. You're going to repeat that for about 30 seconds. You might feel yourself sway a little bit. That's normal. Then the next step of that will also include looking up and then looking down for about 30 seconds. Kind of normal sway is okay. If you feel that that is too hard, you can widen the stance on the pad and then complete the same exercise, looking left and looking right, or up and then down. Again, with the pad on the ground, you're going to stand to the side, and all you're going to think about is taking a nice big step up onto the pad and then bringing the opposite limb onto the pad, and then stepping off the pad. Stepping on and then off. This is just a lateral stepping onto an uneven surface. We'll be reviewing toe raises on top of the pad. Step onto the pad. This is going to challenge your base of support on an uneven surface. It's a little higher level of an exercise. All you're going to do is go up onto your toes, hold, and then come back down. Again, you might want to repeat 30 times and then take a break, or 10 times and then take a break. And then step off the pad when you're done. Another higher level exercise is marching on the pad. Step up onto the pad, alternating lifting your knees to about approximately the same height as your hips. If that's too challenging, just lift lower. Single limb stance is probably the hardest exercise to perform on this pad. Typically, a patient will work up to 30 seconds. All it consists of is stepping up onto the pad, lifting the opposite limb, and then holding the position for 30 seconds. Typically trying to focus in on an object far off so they can maintain their balance. An exercise that will involve all muscles of the body includes a squat, at the same time also working on the patient's balance. Simply bend and then come back up, making sure your knees don't come over your toes. A dynamic exercise consists of performing lunges while stepping on top of the pad. Again, make sure your knee doesn't come over your toe. The further you want to go down, the larger step you're going to have to take. Typically, these exercises are completed in 3 sets of 10, or until the patient fatigues. If you've reached the level where 10 is not enough of a challenge, you can try to do 15 reps. That is a simple progression that the patient can do at home.